Hello, and are we live? Hello, today we are going to have our live on cervical cancer. January is Cervical Cancer Awareness Month, and good morning, good afternoon, good evening for our audiences who are joining from all parts of the world. We have with us three guests today. So let me start with the introductions. We have Summer with us joining from Singapore, and she's the ambassador for the Alliance for Active Action Against HPV. We have Deidra Mai. She's a community health advocate, and she's joining us from Malawi. And last but not the least, we have Dr. Sharon Kapawambe from WHO. She's the Technical Officer of Cancer Control in the Africa region. So welcome all. Today we're going to have a pretty important discussion on cervical cancer. January, as you all know, is Cervical Cancer Awareness Month. So Dr. Sharon, let me start the first question with you. Could you please explain what is cervical cancer and how exactly does it develop?
Okay, so cervical cancer is a cancer that is found in women. The cervix is the mouth of the womb. We can call it the mouth of the womb. The womb is where the baby will sit when you're pregnant, and the cervix is where the baby will come out from to come to the outside world. It's also the place where your periods, if a woman is still having her menstrual periods, that's where the blood will be coming out from. That is the cervix. So when we have abnormal cells, which later can turn into a cancer because of where those cells are starting from, we call it cancer of the cervix. And cancer, the causative agent, the necessary causative agent that we have is known as human papilloma virus. So when somebody, which is predominantly sexually transmitted, so when somebody has the HPV infection, meaning that they have obtained the HPV infection predominantly through sexual transmission, this then, from the infection, it will move into, if the body within about 24 months, 18 to 24 months, naturally can clear this infection. If this infection is not cleared, it will move on to what is known as persistent infection. And it's from the persistent infection that you'll be able to get early abnormal cells, which are still forming on your cervix. And those might then proceed to become cancer of the cervix. So majority, up to even 80% to 90%, can be able to clear this within the 18 to 24 months that I've talked about. But we have this 20% that develop this persistent infection, which can later progress to abnormal cells to cervix, to cancer of the cervix. And the reason for persistence could be because of having some underlying problem that a woman can be having. For example, immunocompromised, which can be due to having HIV, or it could be because they are having a treatment, for example, excessive treatment for just another cancer. They could be having a kidney problem. They could be having something that is compromising their immunity and therefore failing to clear the infection, which later can go into becoming cancer of the cervix.
All right. And how important, like Summer, you were somebody who, when you discovered you had cervical cancer, what were the initial signs that led to your diagnosis?
Okay, so I was facing some unusual bleeding, especially after intercourse. And at that point of time, I did not know that it was a symptom until a half a year later because I thought it was irregular menses. So, yeah, so after intercourse, there was bleeding, but I didn't take too much notice of that until 6 months later when I went to the doctor. That's when I was diagnosed with cervical cancer.
And in your experience, Summer, what has been your experience like with diagnosis and the treatment? Like, how important do you think, would you believe in early awareness? And how is your organization helping with that regard?
So, because for me, I had I was first diagnosed when I was 24.
Mm-hmm.
So as we know that cervical cancer kind of like happens to women age 35 and 35 years and above. So I was one of the youngest cervical cancer patient at that time at the age of 24. So I think that it's really important for everyone to know that cancer doesn't choose what age you are in. So it's very important to get your vaccine done and also your screening so that to prevent any kind of like um, prevent any cancer. So I think that's very important. And for my organization, we are very highly kind of like we are a group of youth
Mm-hmm.
who are actively trying to encourage people to go for their vaccination, especially in Singapore, whereby it's not very highly, I would say the government is not very proactive in doing the awareness. So we are trying to make sure that as many people know or as many youth to actually get their vaccination done because after 26 years old the vaccination is there's not so much effective in that around that age, so it's
Mm-hmm.
best below 25 26 25 or 26 years or below. Yeah, so that's why we are working on that.
Okay. And Dr. Sharon, could you explain what are the different types of screening tests available today and how often should women and girls should be taking them?
Thank you so much. So currently, the WHO recommends a high performance test to be used. And for a high performance test, we're basically talking about HPV test, which can be, for example, a DNA test that is available. And we say that we've got the elimination agenda where we are saying 70% of the women by 35 and by 45 years of age are screened with a high performance test. So one of the tests that we are recommending, because that's the one we know that at the end of the day, as we look at accelerating the elimination of cervical cancer, is the HPV test. And basically, this is a test. The other advantage it has is that you can also use self-sampling, and that you empower a woman to be able to go and take the test themselves. They can, swab, get their test and put it in a bottle, bring it back, the specimen to the clinic, and you test it. And then, so that is one of the tests that we have. The other test that we have, predominantly when you look at the low to middle income country, if you're looking, for example, at the African region, you find that most of the countries are still using visual inspection with acetic acid, which is just our vinegar. So this is one of the tests, and this is usually done in a screen and test mode, meaning that somebody will go to the nurse, they'll swab, put a cotton swab in the vinegar, which is like the household vinegar that you use. But this has to be done by somebody who's trained because they are the ones who can be able to see the changes. And then finally, of course, we see that most of the people are also using pap smear, which is very common. So people will use pap smear. So there's HPV DNA, there's also mRNA that you're using for HPV. So let me just say HPV tests, and then you have the pap smear, and then you have the visual inspection with acetic acids that we're predominantly using as for screening in most of the public health programs.
Um, then we have some questions coming in from the audience as well. But before I get into it, I have a question for Deidre. Deidre, you're a survivor yourself. How was your experience in terms of the treatment process and the side effects? How did you manage it? I don't think we're able to hear you, Deidre. Do you have your mute on?
Just
Yeah.
briefly, just to say that I'm now 48.
Mhm.
I was found with cervical cancer in 2018, but I started suffering in 2016. That's 2 years. I started with abnormal discharges, discomforts, lower abdominal pains, heavy bleeding. I underwent so many surgeries. They said I had fibroid tumors. I went through a lot. But then in 2018, after 2 years, um, that's when they thought the government hospital then thought I had an abnormal tumor um, down there in my cervix. So they recommended um, a biopsy, a test, a DNA test, so
Mm-hmm.
that they can test me for cancer. But then they said that for the results to come, it's going to take quite a while. But then they referred me to a private hospital. So I went to the private hospital, which was very expensive and very costly. The private hospital did the biopsy, and they really did find that I had cervical cancer cells in me. So they recommended the surgery. But then the tumor and the cancer was in stage 2, and they recommended that so that it should not spread, they should take out all my reproductive organs, which they called a total hysterectomy. So they removed my cervix, they removed my ovaries, they removed my productive organs. So that's what I went through. That was in 2018.
Mm-hmm.
Yes.
And Deirdre, you've been a very strong advocate for raising awareness on cervical cancer, and how important it is for early screening and getting the support you need. What has been your journey like? What has been your experience like as a community health advocate?
As an advocate, what we are advocating for now, like Sharon just shared, is that governments, testing is available through virtual inspection using the vinegar, but then there is need for governments to accelerate awareness in our young girls to go for testing, for screening, the virtual screening, but at the same time, there is a vaccine. Dr. Sharon has already described um, what the HPV is, the virus is. So there is that opportunity for our young girls not to go what I went through. I
Mhm.
went through that when I had already children. So we want to avoid that with our girls, with our young women in Africa. We have the opportunity. They should go for screening. They should have access to the vaccine, so that they should not undergo what I went through. Because what I went through, I used a lot of resources going to hospitals, going to private hospitals, and I went so many surgeries where if I had gone earlier, if I had been screened earlier, I could not have gone through all these problems that I went through.
So I want to remind our audience at this point that if you're on Twitter, which is X right now, please use the hashtag AskWHO to ask your questions, and we'll be taking them on air. In the meantime, we have some questions on, I think this is on LinkedIn, from Ramazani. In low development countries like in the Africa continent, the demands for screening is there, but there is no program in place. What is being done about for women who are not economically well off to access these kind of facilities? Dr. Sharon, would you like to take that question?
So we have screening that is available. Screening is available in about 34 countries in the WHO Africa region, and more countries starting. Are we at a place where we should be? No, we're not. In the right direction, but a slower pace, which we need to accelerate. And we have 17 countries that are using HPV tests, even though it might not be at national levels where the whole nation is using that. Most of the countries are still using, about 50% of them are still using visual inspection with acetic acid. Some few countries using pap smear, but majority will find visual inspection with acetic acid. What is needed is really to ensure that there are policies that are available to be able to ensure all women are getting screened. And screening is recommended from the age of 30 to 49 by the WHO recommendations. And for women living with HIV, we recommend that they start screening at the age of 25. So we are saying for the general population, 30 to 49. And the reason why we are starting much earlier in a woman who's living with HIV is because women who are living with HIV are 6 times more likely to develop cervical cancer compared to the general population. So yes, we have countries starting to screen, but they are not at full scale where we can say 70% of the women are actually getting screened.
Dr. Sharon, we have another question, and this is on availability of tests. It's from Tosin Oview. What's the availability of HPV self-tests that you explained?
So the self-testing, most of the countries that are actually even in Africa are using self-testing. So there is a special brush which is there for self-testing and a specimen bottle where a woman is taught how to get the specimen from her private part, from the reproductive part, where she can be able to get these cervical smear and put it inside that bottle and take it to the clinic or the facility as they will be directed. And that then is what we go and test. And in that test, we are actually testing for HPV. So when it comes back, we will be able to say she has HPV, is HPV positive or is HPV negative. And in some instances, we can actually, because it's not one HPV, we have different types, over 100 types that are causing the infection. So we'll be able to say you have such and such type of, you have 16 or 18, which is not common. And then we'll be able to tell you which is most common is the 16 and 18. Type 16 and 18 is what we have most commonly causing cancer of the cervix. So a woman will be told in some cases what type she has, or will just be able to say you're HPV positive. This is unlike what we see when you do a pap smear or you do visual inspection with acetic acid. What we're actually telling you when we get the result is that there is some abnormality that is going on your cervix. We are not telling you that HPV is present, but we'll say looks like there's something that could be causing, which is most likely HPV on your cervix. So we have noted abnormal cells and we treat those abnormal cells. So that is why you're looking for shifting, which is something which needs a global agenda to be discussing much more, ensuring that there are policies which are available to scale up and to have more affordable, accessible HPV tests.
Thank you, Dr. Sharon, for a very well-rounded explanation on testing. I'm going to go to Summer now. Summer, how has your experience of this changed your perspective on life and health? What have you really learned from this journey, and what do you want young women and girls to take away from your experience?
Well, my life before cancer was quite unhealthy in a sense whereby I was a workaholic. So I worked from Monday to Sunday, morning to dawn, working 4 jobs a day. Um, so I was like working my my ass off in a way. So I don't have regular meals. I don't sleep well. I don't eat well. I don't sleep well, and I work really hard under very stressful environments. So my physically, mentally, I was not healthy at all. And my life, so after cancer, that's when I start to love myself more and also really take charge of my life in order to have a more balanced lifestyle. So now I appreciate um, time by myself. Last time I hate to be alone, but now it's like I start to really want to eat more healthily, more consciously. At the same time, making sure that I'm not under a lot of stress. Even if I'm stressed, I will find way to de-stress as well by doing something that I love. For me, I love horse riding. I love drawing, singing. Just really making time for yourself. Um, I think that's really important, and also reconnecting back to our soul. So I do meditation. Yoga is one thing, but I think meditation is also very important because that's when we let our mind rest and also for us to reconnect back to our soul. So for me, what I would like to really share with people, or rather people around my age, is that, you know, work is not everything, but we are in this world for a reason to learn constantly. And I think that one thing that I'm learning every day is how do I actually love myself and um, be here in this world for a purpose to share my experience. And for you who will be it whatever experiences or challenges you are going through, know that you are not alone and know that this is not permanent. The challenges will pass, and if you are able to overcome that challenge, you will grow stronger, more resilient, and at the same time, um, I would say you will become a butterfly eventually. Yeah. Mm.
Thanks, Amar. That's absolutely a wonderful way of kind of explaining your journey. You had a tough period, but you triumphed over it, and you offer a lot of good advice to young people in terms of screening, taking care of their physical and mental well-being. Dr. Sharon, there have been some questions on the efficacy of the HPV vaccine. Would you like to talk to that particular question?
Yes, please. And like we said, I talked about the necessary causative agent for cervical cancers being HPV, the human papilloma virus. And we know that because of that, that is where the HPV vaccine comes from. So HPV vaccine is basically recommendations that have been is given to girls between the ages of 9 to 14 as a WHO recommendation. Of course, there are different brackets. Now we can say they can give up to women up to 45. But we must note that for the younger a girl is given the vaccine, the better the outcome. And I'm talking about the efficacy. So we've had studies coming out of Denmark. We've had studies coming out of England. We just had a study, I think it came out last week, out of Scotland, which are showing the same, the reduction in invasive cancer of the cervix in the vaccinated population. And you see that for the girls who are 12, 13, and below, you see that up to 80% reduction is seen. For those who are much older, you see that it's below 50%, the reduction is seen. And that is where the recommendation of giving the young girls comes from. But that doesn't mean that someone who's older can't get vaccinated. But they need to know that the reason we're giving that age, because that is because of the proxy of sexually transmission, the chances of being sexually active at that age is much lower. Hence, you're choosing an age which is going to give the most benefits. And yes, like I'm telling you, these studies have been done and they're beginning to show that the most reduction we see is in girls 12, 13 or below. And then we're seeing the older we give the vaccine, there is reduced efficacy, but there is some protection that is still conferred. So yes, we've seen a reduction in infection. There are studies that have also been done in Rwanda where you see the reduction in HPV infection prevalence in that population. So to answer your question, yes, we've seen a lot of effectiveness that has been seen and is being seen in populations that have been vaccinating for quite some time now.
I'd just like to convey a comment from our audience, Benda, and this is towards Summer. She's saying that, Summer, thank you for that insight. Make time for yourself. Quality of life and survivorship matters so much. So that definitely resonated with our audiences joining from all parts of the world listening to this conversation. Deidre, I would like to come to you and ask you a specific questions which is basically the cervical cancer presents a very significant public health threat to women in Africa. What steps do you think are needed now more than ever to eliminate this threat?
The first thing that's needed, like Dr. Sharon has already said, is the first thing to be done. The first thing to be done is to prevent the cervical cancer itself. It's by vaccinating the younger girls who are not sexually active, but then to raise awareness within the age bracket that is sexually active. But then when it comes to public, I would want to say that our main focus is to make sure that we prevent the cervical cancer in our young girls and our young women. That's the hub. That's the hub of it. Where you may be prone to have cervical cancer. That's where now, in terms of public health, I would want to bring in an element of HIV, like Dr. Sharon mentioned, that women living with HIV are prone to have cervical cancer 6 times. I had I was diagnosed with HIV in 2002, in the year 2000. So the fact that I had cervical cancer in 2016 could be the reason that I had HIV. My immunity was compromised for all these 16 years, or before these 16 years. So our advocacy is really hinging on the prevention, encouraging our governments to accelerate access to the vaccines and to accelerate initiatives to raise awareness to our young girls and to bring the screening services closer to the community of our young girls and our young women. I would want to commend my government. Those initiatives are being done at a certain level. I've seen I've seen nurses, I've seen doctors, I've seen medical practitioners come to their communities, raising awareness, and after some time they do the testing in the communities, which is a very good initiative. So yeah, so I would want to to recommend that governments in Africa, they should accelerate these initiatives. That is the only way we can prevent this cervical cancer.
And
To
Deirdre,
prevent this bleeding, to prevent these discharges, to prevent all these discomforts. There are ways to prevent this.
absolutely. If detected early, it's one of the most preventable diseases, and you really encapsulated that very well, Deirdre. I just want to ask a question from our audience who are talking. It's a very pertinent topic. Kirith is asking about what role do parent and community education play, specifically in certain cultures, maybe conservative culture, to talk about cervical cancer and raise awareness? How do you overcome these barriers? I don't know, maybe Sharon or Deirdre, you would like to address this?
Okay.
I can come
I'll
in,
start.
Sharon.
Okay. You want
As
you
a,
want you
Go ahead,
it's
Deirdre, go ahead.
all
yeah,
right. I go ahead. I can I'll all
yeah.
I can say probably from our end is awareness is one of the causes that we have. And we must begin to understand that cervical cancer is a form of social injustice against women. And we know that the women most affected are women with low education status. Um, so you are bringing in issues of power dynamics. There are women who want to come and get screened, but perhaps they need to get permission from someone, or you see that most of the women who are presenting late are women of low education status, which is causing a reason to ensure that the information we're giving women is what they can be able to understand. But most importantly, that it's not, yes, let's make sure we do, all these pillars are there, but governments must also start putting into place the other social pillars, improving the education of women, which is what we're doing, must be increased to a larger extent, ensuring that there are laws that are protecting women, there are laws that are empowering women. Um, so that even if it's issues of domestic violence, it's issues of representation at a different level should marry together, because remember, there are biological factors and there are social factors. And we will prevent with vaccination, with screening, with treatment, tackling the biological issues. But at community level, at individual level, at government level, they also need to make sure that this is coupled also with the social factors that make women not go early. The same way we looked aggressively at HIV, the sad part is a woman will get treated for HIVs getting their drugs and everything and leaving, like what Deirdre is just encapsulating. And you find that you come and lose them to cancer of the cervix because you did not put in interventions to prevent them when they are at a higher risk. So these are the issues that we need to discuss. And I think let me leave Deirdre to talk some more to the other issues.
Yeah, Deirdre, do you have any insight on that? I saw you jump at the question, so I'm assuming that you had something,
Yeah,
a
thanks
few
so
insights.
much. Yeah,
Yeah.
I happen to be a
Mm-hmm.
mom of a 22-year-old and a mom of a 30-year-old girl. So I have two young women. It's a
Mm-hmm.
big challenge in Africa, in our region, to talk about sexual matters in Africa. It's a very sensitive. They're very sensitive issues. So at the moment, the best approach would be to reach out to the mothers at the moment, as much as Sharon has emphasized the need for literacy in our young girls and our young women, but then we still do have a larger population of illiterate young women and young girls. So
Mm-hmm.
the good approach that I would recommend is to reach out to the mothers or mother figures in the communities who would reach out to our young women and our young girls. The other challenge that we have is that we do have male practitioners,
Mm-hmm.
male practitioners, medical practitioners. So in our African setup, it's something which we have not yet accepted, where you would want to open your legs and you would comfortably want a male to examine you. But then we would want to have models like myself, and my fellow advocates and other role models out there who would want to stress the need for the testing so
Mm-hmm.
that they should prevent what I've gone through.
Mm-hmm.
Had it been that I did not have children, I do have children now, but look at our girls now. If they don't go for testing, for screening, they are going to be diagnosed late, and the cancer is going to be in a very late stage, which would mean they would go what I have gone through. They would have their uterus, their cervix, and their reproductive organs removed. So in Africa, we believe having children is worth on its own. It's a culture, so culture sometimes has to be respected. Yes, yeah.
Um, it's a powerful statement to make. It's not easy to navigate such barriers, but it is absolutely important to ensure that everybody has access to the best of health and to the best of information and screening. Yeah, Dr. Sharon. Yeah.
I think, and I want to add about culture. I think it's really about ensuring you understand and use the existing social cultural channels.
Mm-hmm.
Even within Africa, they exist. There are mouthpieces that exist that people will respect to a certain extent. They will know that this is coming from the church, the religious background. Is it from my religion? Is it from my traditional leader, from my religion leader? Is it from my teacher in the community when I'm going to school? So even as we are putting in programs, there is need to understand the dynamics in communities and be able to use those.
Yeah.
And also, I think it's about people. I have noted when women are empowered with knowledge, regardless,
Mm-hmm.
they'll be able to seek that service that you're giving them. It's when they don't understand that myths and misconception is also understanding, cancer is the word that most tribes, most ethnic groups, whatever it is that we really don't find a word in our setting that will describe cancer. We're still cervical cancer. So if you're starting from a disadvantage of not even being able to say the word in your language, then we need to start navigating, because it means this is something that hasn't been discussed. There are people who can discuss sexual issues in very, very guarded, I don't want to call them guarded communities, in a community which is very conservative.
Yeah,
But there are people who pass on that message. The important thing about the people that are raising awareness is to ensure they know those and make them part of answering the questions.
correct. Sama, I will come as a wrap up to this conversation. I will come to you because you shared a lot of from your perspective. What do you think? How do you think individuals can contribute to raising awareness? How can the youth play an active role? You're a youth ambassador, so what have been your learnings?
Um, okay, I just want to also add on to something that I kind of like missed earlier. Well, firstly, actually, I did not take my vaccination when I was young,
Mhm.
and it kind of like affected my health because yes, I was diagnosed at 24. So if would have taken my vaccination, I would have prevented all those suffering that I went through. So vaccination is really important. That's one thing I really want to highlight. At the same time, when I first got diagnosed with cancer, my doctor asked me to remove my womb as well. Um, but I was still very young, so I didn't want to remove my womb because I still want to be a mother myself. And I went to search online for another alternative, and I saw that I can actually just remove my cervix. And went back to the doctor, and the doctor said that yes, I can remove my cervix and not my womb. So I was actually quite angry with the doctor because if I did not went to do my own research, I would have lost my womb and I would not be able to have any kids. So the message I want to bring across is that you need to take charge of your life. Yes, the doctors they are professionals, but I think that we still need to do our part and our responsibility to make sure that we have the information and we are able to be confirmed and be more this I would say really having that power to make sure that we make the right decision for ourselves and not what others say is right because maybe to us it's actually not right. Yeah. And how do you actually really impact others is really more on sharing just any female and males even just ask them, have you taken your vaccination? Like have you, because vaccination is like it's like COVID vaccination because for COVID, if everybody is vaccinated, COVID can be prevented. So it's the same as cervical cancer and HPV. So if everybody is vaccinated, there will not be any more HPV related cancer and cervical cancer even. So whoever you see, just ask them, have you taken a vaccination? And just share the stories you heard and just share. I love sharing is caring, and I'm sure that you want to share the love with your loved one, your friends, and anyone that matters to you. Yeah. Sorry, that's all.
Thanks, Amar. That's a very thoughtful way of ending the conversation. So I'm going to round up by naming some of the countries, audiences from these countries joined our live today. I'll take a few names: India, Nigeria, Pakistan, Spain, Albania, Bangladesh, El Salvador, USA, Mozambique, Cambodia, Colombia, Ireland, Ethiopia, Gambia, Yemen, Iran, Zambia, Turkey, Portugal, Burkina Faso, Estonia, Bahrain, Morocco, Iran. So you see, we had audiences from all over the world listening to these to our conversation and to this: get informed, get screened, get vaccinated, and keep sharing knowledge about cervical cancer with friends and families. On that note, I'll leave the conversation here and thank you so much for your time. Goodbye.